So you may have been diagnosed with diverticulitis and could be wondering, what the heck is that? And how can I make sure it doesn't come back? Well, in this video today, we'll describe the difference between diverticulosis and diverticulitis, big difference, what are causes of diverticulitis, and at the very end of the video, I'll give you my tips and tricks that I would recommend as a GI doctor to make sure you don't get diverticulitis again. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my weekly newsletter. You can get great tips, great tricks, just like what you're going to learn in this video. Diverticulitis, this is actually inflammation of one of the pockets inside your colon. It can cause a lot of different symptoms: pain, fever, sometimes you can also have an abscess, and at times it can also cause a hole in your colon needing emergent surgery. This is a very common condition a lot of people have. This is very different from another condition called diverticulosis. This is the one huge difference I want you to know. Diverticulosis are small little outpouchings in the colon that are very common in the population. This typically occurs as we get older, have constipation, and as the wall of the colon becomes thinner and thinner, you develop these small little outpouchings like little bubbles in a tire that are very common to have. Just because you have diverticulosis doesn't mean you're going to get inflammation of those pockets, which is what diverticulitis is. But I get patients very commonly get those two terms confused, and it's important to know the differences between diverticulosis and diverticulitis. So what exactly causes diverticulitis? Well, the main reason people can get inflammation is that something gets stuck in those pockets. And the most common thing to get stuck is stool. Yes, poo! Good old-fashioned poo will get stuck in those pockets and it can't get out, and over time it causes inflammation. More and more inflammation. And then you'll feel that as pain on your left side, fevers, chills. And the way we can diagnose this is with a CAT scan. Let me tell you what doesn't cause diverticulitis: seeds, nuts, popcorn, things like this. And it's a very common myth that those little things can get caught up in those little pockets and cause inflammation to occur. Let me set the record straight. It does not cause diverticulitis. Go crazy over nut, seed, or popcorn. It will not make a difference to make your diverticulitis worse. So how exactly do we treat diverticulitis? So because it's inflammation, the last term itis means inflammation, the first step treatment that we do is that we have to give you some antibiotics, typically 2 antibiotics that we do to help decrease the inflammation. And once we can do that, that will hopefully make the resolution of that diverticulitis go completely away. There are some patients though that may need a drainage if there's an abscess that's there, or there are other people who actually may need surgery to remove that part of the colon. Once we've gotten over the immediate phase of the inflammation, a couple of weeks down the road, maybe even a couple of months down the road, we may actually have to take a look with a colonoscopy to make sure nothing else is going on in there, because there are other reasons why there's inflammation. Maybe it's something like a cancer that's there. Maybe it's Crohn's disease or ulcerative colitis or a very large polyp. These are things that we need to investigate to make sure nothing bad is going on there and to clear out your colon. So let's say you had an episode of diverticulitis and you want to know exactly what you can do to prevent it. Here are my tips. Number 1, the best thing you can do diet-wise is to have a plant-based diet. We have seen in numerous studies that diet that's high in red meat causes more inflammation to occur, more bad bacteria, and more problems inside your GI tract. And over time, that inflammation will make it more likely for you to have diverticulitis. A plant-based diet decreases the bad bacteria, decreases the inflammation, improves the good bacteria, improves the gut microbiome, and we can prevent that from getting worse. Number 2, like I mentioned before, minimizing the amount of red meat. We're seeing so much information on how bad red meat is for your gut microbiome, and there's evidence that red meat can actually increase your risk for diverticulitis. Number 3 is you have to stop smoking. I mean, come on guys. It's 2021 now. Why are you smoking? There's absolutely no reason for that. And this is another reason why smoking is bad. It increases your risk for diverticulitis. You don't want that. I don't want that. Nobody wants that. Number 4, stop taking anti-inflammatory medications. Things like Aleve, naproxen, Advil, Motrin, ibuprofen. These medications increase inflammation inside your gut and increases the likelihood you're going to get diverticulitis. And then lastly, you may want to consider adding some herbs inside your diet to improve your chances of decreasing inflammation. So for example, garlic. There are some studies that show that garlic has antimicrobial effects to decrease the risk of infection. Number 2 is green tea. Green tea has anti-inflammatory effects to help out with your colon and help out with inflammation as well. Next is ginger. Ginger's been used for centuries for gut issues, whether it's indigestion, nausea, and inflammation. And lastly, turmeric. Turmeric is a fantastic anti-inflammatory medication to help out with inflammation, and this could be one way to decrease your risk for diverticulitis. So these are some of the ways that we treat diverticulitis as a GI doctor. My question today for you guys, what questions do you have about diverticulitis? Comment down below. I'd love to hear what you guys have to say. But thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to our weekly newsletter where you can get great tips, great tricks, just like you learned in this video. Guys, and thank you for watching. Hope you guys have a happy and healthy day. Take care, everyone. Bye, everyone. See ya. If you got value from this video, I would appreciate a like button and a comment down below.